Dr. Higgins, have you noticed patients being able to wean off of prescribed medications by using cannabis as an alternative? And can you talk about which ones?
That has been one of the more surprising and also one of the more pleasing aspects of being a prescriber for medical cannabis when my clients come in and they say, oh my goodness, I started out with this laundry list of medications and now I'm not taking this anymore. Yeah, primarily they're things like the benzodiazepines. So, we're talking our Xanaxes, our Klonopins, our Valiums, those kinds of things. Secondarily, a lot of the SSRIs, which are very, very popular.
Let's talk.
Yeah.
What is an SSRI
It's a
again?
selective serotonin reuptake inhibitor, and
Okay.
they're generally first-line treatments for depression and anxiety.
So Prozac was an SSRI, or does it?
Prozac, Zoloft, Celexa, Lexapro, things like
Okay,
that.
all
Yeah.
very popular drugs
Yes.
nowadays. Okay,
Yes.
and you're seeing patients able to wean off of that and
Yes.
stop taking that
Yeah.
completely. Unbelievable.
Yeah.
Mainly because they're replenishing their system and balancing out and just not feeling the need to use them anymore.
Yeah.
Okay.
That's
How
it.
how extreme is it to wean off of an SSRI? Is there a physical addiction to SSRI? Or is it more mental?
Well, that's an interesting question because there's two types of tolerance. There's physiological tolerance and psychological tolerance. Physiological tolerance is where, okay, our body gets used to seeing something, and that does happen with the SSRIs. And so, to be able to go from taking something to not taking it, many times people get discontinuation side effects,
Okay.
and they end up saying, oh my goodness, I became addicted to that. It
Yep.
technically isn't an addiction, it's a discontinuation side effect. And that's best mediated by tapering off of it, which is what medical cannabis actually allows. Yeah.
Because you're able to balance out before
Yes.
you go through those withdrawals per se, right?
Exactly.
But
Exactly.
weaning off of an SSRI is a lot easier than a benzodiazepine.
Generally
Because a
so.
benzo would a benzo, if you quit cold turkey, is similar to like alcohol. It could block the oxygen pathways of the brain, where
Yeah.
an SSRI doesn't do that.
Exactly. And, with a benzodiazepine, one of the greatest risks of abrupt discontinuation is actually the risk of seizures,
Oh wow,
potentially if the person's been on it quite a while.
wow.
So, it definitely has to be carefully and very thoughtfully done.
Okay.
Yeah.
Well, it's awesome to be part of the natural alternative, and it's amazing to hear the success stories. So, thank you for sharing. And by the
Certainly.
way, that was awesome. Yes. All
Thank
right.
you.
Perfect.